Assalamu alaikum. I'm Dr. Sharmin Rahman, Associate Professor, Department of Anatomy, Adin Yunus Medical College. Today I'm going to discuss about the circulatory system, part 2, which contains the capillaries and veins. Capillaries are networks of microscopic tubes composed of a single layer of endothelial cells. Capillary usually consists of two types of cell. One of them is endothelial cells. These are the chief structural component of the capillary wall, and these are simple squamous epithelial cells. And between the most endothelial cells, genula occludens junction are present. Second one is pericytes. These are cells of mesenchymal origin with long cytoplasmic processes that partly surround the endothelial cells are called pericytes. Types of capillaries are continuous or somatic capillary, fenestrated or visceral capillaries, and discontinuous sinusoidal capillary. Now continuous or somatic capillary. There is no fenestrae in its wall, have a continuous basal lamina. Contains pinocytic vesicles except in the nervous system, and this allows regulated exchange of material. This is figure of continuous capillary where we can see these are cells and these are nucleus, and these endothelial cells are continuous and contains pinocytic vesicles, and their basement membrane is also continuous. This continuous type of capillary we can found in the all kinds of muscle tissue, connective tissue, exocrine glands, and in the nervous tissue. Now fenestrated capillaries. Fenestrated capillaries have pore or fenestrae in their walls that are 60 to 80 nanometer in diameter and covered by a pore diaphragm. The basal lamina of the fenestrated capillaries is continuous and covering the fenestrae. This allows more extensive molecular exchange across the endothelium. In this figure, we can see these are cells or endothelial cells of fenestrated capillary which is continuous, and this contains some fenestrae or pores which are covered by a diaphragm, and their basement membrane is also continuous. And this type of fenestrated capillary we can found in pancreas, intestines, and in endocrine glands. There is an exception, that is in renal glomerulus. These are composed of fenestrated capillaries, that is lack of diaphragms. Now discontinuous sinusoidal capillary. Endothelial cells have large fenestrae without diaphragms, and the cells form a discontinuous layer and are separated from one another by white spaces. The basal lamina is also discontinuous. In this figure, we can see these are endothelial cells of these discontinuous or sinusoidal capillaries that are not continuous, and this is basement membranes which is also discontinuous, and in between cells there are large fenestrae that are not covered by the diaphragm. Sinusoids are irregularly shaped and have diameters as large as 30 to 40 micrometer. It slows blood flow at this site. They permit maximal exchange of macromolecules as well as cells between tissues and blood. This type of discontinuous sinusoidal capillary we can be found in the liver, spleen, some endocrine organs, and in bone marrow. Now, veins. At the discharging ends of capillaries are small venules, the beginning of the venous return, which conducts blood away from the organs and tissues and returns it to the heart. Classification of veins. Veins may be classified as large veins, medium veins, small veins, and venule. In this table, we can see the characteristics of veins. Like arteries, vein has also three tunica or layers from inner to outer: tunica intima, tunica media, and tunica adventitia. In case of large veins in tunica intima, these are covered by endothelium that lies on a basal lamina, and valves may be present in some large veins and subendothelial connective tissue present. In tunica media, connective tissue and smooth muscle cells are present, and in tunica adventitia, smooth muscle cells oriented in large longitudinal bundles, cardiac muscle cells near their entry into the heart, and collagen layers with fibroblasts present. In medium and small-sized veins, in tunica intima, endothelium rest on basal lamina, and valves may be present in some small and medium-sized veins, and also subendothelial connective tissue present. In tunica media, reticular and elastic fibers are present. Some smooth muscle cells are also present. In tunica adventitia, collagen layers with fibroblasts present. In venules, tunica intima is lined by endothelium, lies rest on basal lamina, and in tunica media, sparse connective tissue and a few smooth muscle cells are present, and in tunica adventitia, some collagen and a few fibroblasts are present. This is the microscopic structure of a vein. This is tunica intima layer. Here we can see a valve, and it is lined by endothelium, rest on basement membrane. And this is tunica media, where connective tissue and smooth muscle cells are present. And this is tunica adventitia. In this figure, we can see the large vein, which consists of endothelium and subendothelial connective tissue in tunica intima. This is tunica media, where connective tissue and smooth muscle cells are present. These are smooth muscle cells. And this is tunica adventitia. In vein, tunica adventitia is more thicker than tunica media. In this tunica adventitia, we can see these are vasa vasorum, and these are longitudinally running smooth muscle cells fibers. In this figure, we can see the difference between the artery and vein. First of all, in the lumen of the artery, there is no valve, but in the lumen of a vein, valve may be present. In tunica intima layer, in case of artery, there are endothelium rest on basal lamina, then subendothelial tissue and internal elastic membrane present. And in case of vein, there are presence of connective tissue. In case of vein, in the tunica intima, there is presence of endothelium rest on basal lamina and subendothelial connective tissue present. And we can see in the artery, tunica media layer is more thicker than tunica adventitia. And in case of vein, tunica adventitia is more thicker than tunica media. So these are the histological differences between artery and vein. And that's all for today. Thank you.